Hello, friends. This is Dr. Aishwarya Kaushik, founder and director of the Premier Endodontics and Conservative Dentistry Institute. Friends, I have a very important announcement to make today. We are going to be starting with our microscopic endodontics hands on workshop, or you can say training course for this year, right? Now, the important highlights of this course is that each and every participant will be provided individual microscopes and they will have dedicated workstations. The course is going to be the practical hands-on component of this course is going to be a marathon 3-day course in which we are going to be not just restricting ourselves to the ergonomics or the introduction of the microscope. We are going to be starting with that, but over the period of 3 days, we are going to be covering each and every important clinical aspect of endodontics: diagnosis, case selection, access cavity prep, working length determination, cleaning and shaping, and obturation. Each and every step up to advanced endodontics will be done by you under at your workstation, under your individual scope, with your extracted tooth right under your nose, right? The second most important thing is that I don't want to just, teach you these things uh, simply without any perspective of, hardcore, you can say clinically oriented based theory classes, right? So this is going to be a hybrid kind of a conference or workshop, if I may use the word. What we are going to do is that the hands-on part is going to take place in the latter part of this year, about in December 2023. But we are going to be starting with clinical oriented online lectures so that we save up on time during that hands-on portion to be conducted. So we are going to be taking very short, crisp, interesting, only clinical oriented lectures in the online mode right from 1st October 2023. All right. And they're going to be taking place. We'll have around 5 to 6 such lectures on every alternate Sunday, short duration, 1 to 1.5 hours to keep your interest going and flowing. All right. And then finally, when we actually physically meet in New Delhi at my center, we are going to be just combining all that knowledge, revising that in a short period of time, and giving you the maximum hours during those 3 days of workshop. My team will be there to support you for your accommodation, your sightseeing in New Delhi. And yes, one very important thing, we are also going to be having a surprise, guest lectures from the best faculty of endodontists, right? We are going to be having one of the best mentors that you could think of. Obviously, I'll be there hand holding your way throughout the phase, right? Just a short, perspective of how we're going to approach this. This is going to be very interesting, friends. Let us just have a very short perspective of yeah, there you go. I think we're right on the money here. Yeah. So that's me in my practice, friends. That's my best friend, my Labomed operating microscope. I perform all my procedures under the with the help of my best friend. That's my microscope. Just to give you a basic perspective, you can see this right on your screens here, right here, friends. You have this. I've taken this X-ray. There's rubber dam isolation. What are the things that we've done right here? Of course, we've used the rubber dam. Second, we've secured our clamp with a floss ligature, right? What are the things? What other things can you see here? That's an obturation. There is some. This is upper first molar. There is some slightly excessive cutting on the pulp chamber floor. Why is that? Probably I was not able to locate the mesiobuccal canal orifice as easily as the other two orifices, right? What do you do in such a situation? Do you use a burr or do you use ultrasonics? How do you use that? How do you do that under the operating microscope? How do you ensure that perforation does not take place? During obturation, did I choose a warm vertical compaction method, or did I simply obturate it with a single cone cold condensation method? If yes, if no, then why? What are the advantages? What are the disadvantages? What is the case selection? Not just for selecting your case for root canal treatment, but for each and every step. For instance, I have done my satisfactory root canal cleaning and shaping, and I've gone, say, to the apical preparation size of, say, 35 or 40, but my taper is not that great. I don't have that shape which would ensure that I have a good resistance form in order to prevent my GP from saying hi to the periapical tissues, right? If I do a warm vertical compaction method. So in what cases can I do that? What cases do I prefer not to go for warm vertical compaction? All these dilemmas, your problems with working length determination with your apex locator, its correlation with your X-ray, your choice of post-endodontic restorative material. In what cases will you go for a full coverage crown? In what cases you might just tell the patient, oh, you're going to be well, you're going to do fine without a full coverage crown. In what cases would you go for a 6% or a progressive taper, a pro taper technique? In what cases would you prefer a 4% cleaning and shaping and taper? If you are choosing for a 4% taper, what is the ideal apical preparation size? If you are dealing with a vital tooth versus a non-vital tooth, how much should you prepare? Where do you stop? All these dilemmas will be addressed by me and my faculty. Everything would be done under your individual microscopic workstations, and everything would be, the theory and your practical would be correlated, and you will go home, you will go back to your practices with newfound confidence with working under the operating microscope. Friends, my theory sessions are going to start from 1st October 2023. Hands-on practical workshop 8th, 9th, and 10th December 2023 at my New Delhi Center. You're all welcome throughout the country. Everyone, your general practitioners, specialists in other branches, endodontists who are yet to incorporate the operating microscope in your practice. Friends, all of you are invited. Since this is a hands-on training, this is not exclusively a theory lecture, there are limited seats available. So guys, we want, this is a first come first serve basis, as my anatomy HOD used to tell us, no sifarish. So I'm going to be, I'm very excited about this course. I'm going to be meeting you in December, obviously for the physical hands-on workshop, but we're going to be starting our classes very soon, right from 1st October. That's a Sunday, and every alternate Sunday, we are going to be orienting you towards, I'm going to be showing you videos of my cases that I do under the microscope, the troubleshooting that we have to do, everything related to clinical oriented lectures, right? And then we're going to be combining all that knowledge and imparting you with the skill that is required to perform satisfactorily, happily, all the endodontic procedures, right from case selection to obturation under the operating microscope. I look forward to this course. Feel free to connect with me, contact me. You all know where to find me. I'm there. My presence is there on Facebook. We have our, the Premier Endodontics and Conservative Dentistry Institute Google page. My practice name, South Delhi Dental Clinic and Implant Center. So you can contact me there. The phone number, email, everything is mentioned there. And I look forward to this. Best wishes, friends. Thank you.